of the East of England Cancer Alliance, and it's the patient partnership group at whose initiative this series of events has been organised. This will follow the usual format, and for those of you who haven't been here before, we start with a 20-minute presentation from a clinician, followed by a 10-minute presentation from a patient. That part of the session will be recorded, and the recording will be placed on the Cancer Alliance website once everything's been put together. So if you don't want your face to appear on that website, I suggest you switch off your camera for the first half hour. But then, and while that's on, I should say also, if you have any question or comment to make about what you're hearing, please put it, as soon as it occurs to you, please put it in the chat, because in the second half, when the recording will have stopped, Jane Parker Colson, who's the PPI lead, give him a wave, Jane, will be monitoring the questions and putting them on your behalf, so that if we don't get through all the questions by the closing time of 7:30 or just afterwards, then either Lara or Karen will provide answers, and they'll go with the recording onto the website as questions and answers to complement what you've heard tonight. And it'll help people who haven't been able to get here tonight, but who are interested. So, having got that stuff out of the way, I'd like to turn now to Lara Anthony, who's a therapeutic radiographer who specializes in late effects. Over to you, Lara.
Thank you very much. I'm going to try and share my screen, but just bear with me while I get to do this. And then put it into... Can you see this screen with my cursor on?
Yes.
Yeah, perfect. Not the one with black, because then you'll have all my notes as well. So yeah, let's get into this. Firstly, I'd just like to thank Ray and Jane from the Patient Partnership for inviting me to come and talk today. As Ray introduced me, I'm Lara. I'm an advanced therapeutic radiographer based at the Norfolk and Norwich, and I work looking after people with late effects. I qualified in 2010, and I worked on treatment machines as a radiographer. Then I worked in the review team, looking after the immediate side effects of treatment. 2 years ago, we started a pilot to do this late effects service, which was kindly funded by the East of England Cancer Alliance. It's been a long journey, and the service continues to develop and improve. We've had funding continued for another year, and I hope that we can get this service fully funded. As a radiographer, my knowledge is specialised in the late effects of radiotherapy, but I will discuss a few of the chemo and surgery and immunotherapy late effects as well. This is just a little bit to say that I'm a human, you know, I specialise in radiotherapy as a job, but I'm very partial to my family, holidays, and seemingly ice cream. I thought that, I don't know how I've managed to put that on there, but we'll go with it. So let's kickstart with what are late effects. Just talking about this picture, it's just to represent that we're all really different, all literally different, all experience different things. But the importance that late effects can be a really lonely place, and hopefully you'll get some support from tonight's meeting. Fundamentally, a late effect is a health issue that happens 6 months or longer after completing radiotherapy. It is different to the short-term effects. However, a late effect can be classed as a short-term effect that doesn't ever get better. These can be physical effects, but they can also be emotional and social. I think it's also really important to remember that it's not guaranteed that people will have late effects. And use the word rare, but it's not that late effects are rare, because they're very common. However, 50% of patients will have a symptom following their radiotherapy, and of that 50%, 25% of those will have a symptom that does affect their quality of life. So yes, it's rare, but that's still 12.5% of people who have treatment that will get a late effect. So I don't want this presentation to scare you, but I think it's really important to be equipped with some knowledge and understanding of how to cope with it going forwards. So currently there are 3.5 million people who are living with and beyond cancer, and that's expected to rise to 4 million people by 2030, which is brilliant news. But it's a double-edged sword, because if we take that 50% of patients who will get symptoms following radiotherapy, that's potentially 2 million people in the next 5 years who are going to have an impact from their treatment. And that's an awful lot of unmet need that people have and are facing. So we've been developing and improving services to help those people, and it's definitely becoming more highlighted in the need for these services to be available to people. As I said earlier, as a radiographer, I specialise in radiotherapy, but late effects come from all treatment modalities, so surgery, chemo, hormones, immunotherapy. And it's important not to make out that one is better or worse than another. It's really important that we think of the individual and the impact it has on them, because, for example, someone might have hair loss, and some people might not be bothered by that, but to someone else it's a massive impact. They'd be unable to look at themselves in a mirror, they would be reluctant to socialize, see friends, they would be reluctant to go out to work, and this causes a massive impact on their quality of life and their self-worth. And sometimes it's just hard to look at in a mirror to have that permanent reminder of what they've been through. So it's very important to think of the quality of life impact on a patient with a late effect. It's not just this late effect is okay and this late effect isn't. It's what it impacts the patient. So Macmillan got some data last year and found that we have 43 adult services for late effects across the UK. 18 of those are radiotherapy specific, 15 are pelvic radiotherapy specific, 2 are head and neck specific, and 2 are for immunotherapy. Obviously, there's a lot more hospitals that give radiotherapy and cancer treatment than 43, so still a big way to go, but we're getting there. Within the east of England, as I said, Norfolk and Norwich was funded to have an all-body site radiographer-led clinic. Mid and South Essex, in Southend, they have a pelvic consultant and nurse-led service, and they have it. There's an advert out for a head and neck role, and that's a similar with Esneft. So Colchester and Ipswich have an advert out for a pelvic service. As I said, there's room for improvement, but know that everyone working in late effects is striving to improve and develop the service that we can give. So if I talk a little bit about radiotherapy late effects, why do they happen? A massive part of my role is explaining and giving out reassurance for late effects, because it's a really daunting experience to have this symptom, particularly when you've had a cancer diagnosis. Generally speaking, it's due to radiation fibrosis. You have radiotherapy and it's used to kill cancer cells, but it also damages healthy tissues that are nearby. And your body tries to heal the damage to those cells, but sometimes it creates like scar tissue, and it can make those tissues change to become more stiff or thick, and they're less flexible. And because of that, it can change the function or that part of the body. It can affect various areas like your skin, muscles, organs. It can cause pain, stiffness, and functional limitations. As radiographers, we are trying to keep the damage to a minimum. That's why when we set you up, we are taking images, we are resetting you up, we are making sure we are exact. It means that we can put the high dose to the tumour, but there is an element of some of those healthy tissues getting treated. Obviously, the other treatment modalities do give side effects, and I'll touch on those in a bit. But again, not forgetting the psychological impact. It comes from the diagnosis, the treatment, the subsequent issues. There's a massive problem with survivorship guilt, and risk of recurrence is a really hard thing to process and live with. I've got this picture here because radiotherapy is known as the gift that keeps on giving, and that's often how we describe it in the late effects world. So what could be expected? the side effects will be localized to the treatment area. So if you had your pelvis treated and then you had a runny nose, it's not going to be related to your radiotherapy. They are going to be very different to each individual. And just because your friend or neighbor had the exact same treatment as you, it doesn't mean your body will respond the same way. So it's really different individually. And there's also important to consider other factors such as age and comorbidities and genetic factors, because they do impact on these symptoms. I will also say there's not always a fix, but that's not to say that there isn't a way to help improve your quality of life. What do I mean by localized? So here we have some pictures of radiotherapy treatment plans. The colours vary in where the dose went in. The high colours are the red, and then it spreads out and gets lower, and the like when we get to like the blue colour, it's a really low dose. But as you can see, for this person that's had head and neck treatment, all of these tissues have had some form of radiation and there's caused damage to them. Likewise with this pelvis, this is a prostate treatment. You know, this yellow thing here is your bladder, so there's a proportion of your bladder being treated, and likewise this is the rectum, there's a proportion of that that's been treated. So those cells have healed, but they might have healed differently, and that might have caused those late effects. Likewise with this breast, you know, it's more sometimes than people realize. It goes down quite low under the armpit, and people sometimes can be a little bit shocked. So I would always encourage people to ask to see their treatment plan so they can see physically where the dose went. And as I said, radiographers are striving to improve how we plan to reduce the toxicity or the damage to those other cells. So some examples of different late effects, and again, I don't want to scare people. I will highlight that when you signed a consent, it would have had your possible late effects in it. It would have had the possible acute side effects and also the late effects. So I'd encourage you, if you haven't got a copy of that, to ask for it so that you can remember what things might happen to you. It's also important to remember that it's not just physical side effects. There's a massive psychological impact. You know, people who might have had their head and neck treated might not want to eat in public. They might fear of dribbling. They might not be able to physically eat in public anymore. You know, or not eat in general. Might be using a tube to be fed, and it just can really impact that quality of life element. Likewise, if you've had your pelvis treated and the fear of needing the toilet so urgently is such a big impact that you just don't leave your home. There's massive impacts on relationships. Obviously, hormonal treatment can cause sexual dysfunction changes, but also there's the simplicity of a kiss that can be really hard following head and neck treatment, whether it's physically being able to move your mouth or whether it's a fear of bad breath or things like that. It can be really make a massive impact to relationships. It's also important to remember that going forwards, if you've got a symptom or a change that is local to the area you had your treatment in, that it is a big possibility that it was due to your treatment. And I'll talk a little bit later, but always have that in mind when you mention it to a doctor or whatnot. So, as I said, I specialise in radiotherapy, but mention some of the other common late effects from the different treatment modalities. Surgery, obviously, you can have pain, it can be lymphedema and changes to the skin. And depending on where you had your surgery, for example, if you have your bowel have surgery on your bowel, it has a massive impact on the way your bowel works. But also, they're the physical side effects. There's the emotional impact on that. The change in your body image can cause anxiety or depression. If noticing that visible functional change after surgery can have a massive impact on people. Chemotherapy, again, these are physical mainly, but there's also the cognitive of chemo brain, and it's a real thing. You know, memory issues and slowness in processing information and keeping attention is massive. Just highlight here fatigue, because fatigue is on quite a lot of things going forwards. If we go with immunotherapy to start with, obviously it can have it can cause issues with endocrine, it can cause thyroid dysfunction or adrenal insufficiency. It can cause pneumonitis in the lungs. It can cause joint and muscle discomfort, skin issues such as rashes. Again, fatigue is included in that. And there are some autoimmune conditions that would need lifelong treatment. Going on to hormones, hot flashes can be massively bothersome for people who, it just massively impacts their quality of life. Bone density can decrease, which can increase the risk of fractures and osteoporosis. Joint pain is massive and often referred to as a type of arthritis. Again, fatigue. Sexual dysfunction is massive following hormone treatment, and that can be changing in libido. It can be erectile dysfunction or vaginal dryness and pain during intercourse as well. Hormone treatment can also cause weight gain. It can cause changes with cardiovascular system, and it can also cause the early onset of the menopause. So part of my presentation, I was asked to, help you to know what you can do to help yourself. So firstly, I'd encourage you to attend all your follow-up appointments. Follow-ups with the consultants should be happening regularly following your treatment. Sometimes they get moved on to your GPs, but I would encourage you to speak up if anything happens. The follow-ups are there to assess tumour response and organise scans and give results. And there's an expectation that the doctor can only deal with that due to a time constraint. And to an element, that's true, because often follow-ups are 20 minutes. And for a doctor to assess you, it isn't an awful lot of time. And sometimes people getting good results from their follow-up can cloud what you wanted to say. You wanted to say you've been struggling with this or that, but you've got good results, so therefore I can't bring this up now. And that's an element of survivorship guilt. Sometimes you feel like you need to just deal with those issues, but I would encourage you that if you're struggling, you need to tell them, because early intervention with those symptoms will result in much better outcomes. As I mentioned earlier, you did sign a consent form and you would have been made aware that these are possibilities with these side effects, but that's not to lessen the fact that at that time you're probably very stressed. You're probably maybe just been given a diagnosis. You're given an awful lot of information in those early days, and sometimes you can be left feeling like, I've just got to sign this consent form and I can't really process that at the moment. So again, like I say, see if you can get a copy of it so you've got it as a point of reference for what you possibly could have. As I mentioned earlier, remember that symptoms can occur many years later, and sometimes you can have completed follow-up, so I'd just like to empower you that if you're seeing your GP, they might forget, that it's not on their systems, this patient had radiotherapy. So you kind of need to remind them and say, I've got some bowel changes, but I had radiotherapy 10 years ago to my pelvis. Do you think it could be related? Because that will help flag with them. Yes, it probably is, and we'll do the relevant tests for that. I'd also encourage, if you do have symptoms, to keep like a little journal of symptoms so that you can have that evidence to show them when and where you're getting those symptoms. Things to ask your GP or oncologist. Obviously, while several regions do have established late effects clinics, access remains limited, but please do seek advice and support from these professionals, because there's lots of them can be managed through primary care as long as you're able to communicate well. I'm about to share some self-management techniques that are really good ways to help manage them, but as I said earlier, it's a really lonely time and place to be dealing with late effects. So some of the self-management techniques are there to help reduce or improve late effects. Okay, so I'm sure you're well aware of them, but it's always good to be reminded. Keeping a healthy diet will support with your healing. It reduces recurrence risk. It helps maintain a healthy weight. It gives you more energy and an improved mood. It also supports bone health, gut health, and digestion, and it helps strengthen the immune system. And it really helps if you had your bowels treated to maintain a healthy diet to keep the bowels regular. Increasing hydration is really, really important, or just staying well hydrated, because that can improve your energy, the mood, your immune function and digestion, and it helps assist with detoxification and skin health. Approximately, you should be drinking 8 glasses of water a day, and it's really good, particularly to help if you've had your pelvis treated, to flush out your bladder, but it also helps, it's good for your kidneys and reducing toxins from your body. Regular and mild exercise is really important, and there's an awful lot of evidence and research going on at the moment to improve that physical recovery by doing exercise following your treatment. It reduces fatigue, it boosts your mental health, it helps bone health, it helps muscle tone, and it is just really shown to be beneficial. Start slowly. There's no need to run a marathon, but a small increase is better than nothing. So we aim to build up to 30 minutes, 5 days a week. Things such as yoga, swimming, walking are really, really good and have got good evidence base to help with fatigue. I'd also encourage you to remember, if you had your head and neck treated, the speech and language therapy team will have given you exercises to do for your jaw movement, and there's good evidence to continue to do them afterwards. Same with if you have your pelvis treated, keep doing your pelvic floor exercises, and if you had breast surgery and treatment, keep doing those arm movements to help improve everything. Smoking and alcohol reduction, although difficult, has been proven to improve outcomes for your treatment and your overall health. So there's always support in doing that. Being aware of your mental health is really important, because post-treatment we face all of these challenges that I've mentioned earlier. So being aware of your own mental health is really important, and there's plenty of things that you can do to help support it. We've got NHS talking therapies, there's charities such as Mind, or for example in the east of England, local charities such as the Big C, which can offer counselling and support. And there's also being generally keeping aware on your overall self is really worthwhile. Like I said earlier, keeping that late effects diary, what you've noticed, so you can then report back to your local checkups, your regular checkups. Having a support network is a massive improvement for dealing with quality of life. A lot of people that I see feel very isolated, even if they have the best family and friends around. They feel that they just don't get it. There are some brilliant cancer charities that I'll mention at the end, and they have peer support groups that help lessen that isolation and build you up. And with all of these, start as early as possible. Cancer-related fatigue, as I said earlier, is part of all of the treatments, is possibly to get fatigue, and it is one of the massive things that I see in my clinics. Cancer-related fatigue is not fully relieved by rest. It significantly impacts on your quality of life, and just want to acknowledge and validate anyone that's struggling with that, because it's massive and it's really hard to fix. So why do you have it? Well, you've got damaged cells, there's inflammation and cellular stress. Hormonal therapies have a massive impact on muscle loss and sleep disturbance. You can get sleep disturbance from the symptoms. So if you're in pain, if you're anxiety, if you're having hot flushes, medication side effects contribute to fatigue. Emotional and mental health strain can worsen fatigue. Deconditioning is sometimes referred to as when patients go through cancer treatment and do less after a diagnosis, which leads to muscle weakness and lower endurance, which adds to the fatigue. So, as I said earlier, it's also important to acknowledge that with age and genetics, they can have an impact on fatigue. But the first thing that we need to do is rule out any underlying issues. So things like anemia, thyroid disorders, chronic fatigue syndrome, depression, because by treating those, it can make a huge difference. Often a simple blood test will be able to rule something like that out. And then healthy habits, as we discussed earlier, gentle and regular exercise like walking, swimming or yoga have been proven to reduce fatigue. So build up slowly. The movement boosts your circulation, it improves your sleep, it builds muscle and strength and counteracts the deconditioning caused by treatment. Keeping good nutrition and hydration is really important. Small balanced meals throughout the day stabilizes your energy levels rather than having one massive meal. And fatigue is worsened if you're dehydrated, so keep well hydrated. Sleep hygiene is a thing that we call for having a regular sleeping schedule, you know, going to bed at the same time, waking up at the same time, avoiding screens before bed, avoiding caffeine, creating a calming bedtime routine, maybe a bath, reading, a bit of mindfulness. There are apps such as Headspace and Calm, or you can watch videos on YouTube or books from the library to help you understand what mindfulness is. And it is a brilliant and undervalued tool for people that are struggling with late effects. The 3 Ps relate to planning, prioritizing, and pacing. So breaking tasks into smaller steps, resting before pushing yourself too fast, and focusing on the most meaningful or necessary activity to do that day. Complementary therapy. So there have been studies to show that acupuncture can reduce fatigue. And like I said earlier, mindfulness and meditation or guided relaxation is shown to reduce fatigue and improve mental clarity. If all else fails, there is a cancer fatigue rehab centre down in Bath that offers a multidisciplinary approach, including physios, occupational therapy, nurses, doctors, psychological support, and anyone can be referred to them. Just wanted to highlight the different support that I have accessed. There are thousands more out there. Pelvic radiation disease, if anyone's had pelvic radiation, I would really strongly encourage you to check these guys out. They've helped us as professionals come up with guidelines on how to manage pelvic radiation symptoms. They've been amazing. I'm sure Karen will talk in a minute about the Mouth Cancer Foundation. Similar with the Swallows, they're fantastic, and Oracle. I would also highlight the Radiotherapy UK website. They have some brilliant videos on late effects. I kind of thought it would just be about the radiotherapy treatment, but they've got some really good stuff out there. And Life After Cancer is also another fantastic charity that I know have presented in a previous one of our Let's Talk About Cancer things. So yeah, these are the ones that I'm aware of. Obviously the Big C is in Norfolk and it's fantastic. So yeah, and then that's me. So I will stop sharing my screen.
Thank you very much, Lara. That was very, very useful. And I'm sure a lot of people will have been inspired by some of the things that you've been saying. But I'd like now to hand over to Karen Schroeder, who is a head and neck patient, to talk about the late effects which she has experienced. Over to you, Karen.
Thank you very much. A big thank you to Jane and Ray for letting me talk today, and for Lara for putting me forward for this. Bear with me, I'm not always very clear, but I hope I will come across okay. Unfortunately, it isn't a completely positive experience that I'm sharing, but I have managed to turn things around to make it more positive because of what I have been through. So I was diagnosed 9 years ago with tongue cancer, which started as a stubborn ulcer. Back then, didn't hear much about head and neck cancers unless a celebrity was diagnosed. Didn't see any posters up about it, any adverts. Now, I didn't fit the criteria because I had never smoked and I didn't drink much alcohol. I was a runner, I looked after my body, and I was 43 at the time of being diagnosed. I also worked full-time in a nursery with young children aged 3 and 4, and this nursery was attached to a school, so it was very demanding with targets we all had to reach. So I had my life-changing surgery where I had the side of my tongue removed. I didn't have it rebuilt, and I had a neck dissection. And then I had to have a peg fitted into my tummy for nutrition, and I had a full face mask for 6 weeks and a mouthpiece with that mask for the duration of radiotherapy. Now, I had excellent care throughout my diagnosis, surgery and treatment, and will be forever grateful to my team who all helped me with the acute side effects of treatment. And I really struggled through my treatment. As Lara mentioned about the consent forms, I will say yes, as patients we do sign consent forms within our medical pathway, but I felt as a patient I didn't really have much choice because I wanted to be rid of my cancers. And to be honest, I looked back at my consent form last week, and the long-term effects don't cover an awful lot. So looking back, I was thinking, yeah, okay. But my acute side effects while I was going through treatment, I had severe burning and pain in my mouth very early on. I had oral thrush, difficulty opening my mouth enough for the mouthpiece, a dry mouth, thick mucus, and my speech was affected, although I didn't actually get support with my speech at the time. And I did return to work full time, and I felt I had to prove myself. And I pushed myself way too hard. I got very run down, and 6 months after treatment had finished, I ended up having more of my tongue removed from underneath this time, and that then led to swallow issues, going back onto morphine and having another 4 months off work, and I almost lost my job. Fast forward to 5 years, which is a massive milestone, and I was still cancer free. I was like big time celebrating. But this is when I think I kind of jinxed things, because this is when my vape effects began. But I didn't really know what they were. I thought I was having more issues with cancer because nobody told me. There was no conversation about vape effects. So my list of vape effects kind of kept growing over time. So my dry mouth was getting worse. My chicken jaw kept locking. I was suffering with burning mouth syndrome in the whole of the months, so I was hibernating throughout the winter, but I couldn't while I was at work. I had nerve pain in the area where my tongue was removed, and that pain was debilitating. I was getting electric shocks all the way through. I was having more and more trouble with swallowing, constant discomfort in my throat, issues with my speech getting worse. If you think about it, we're talking all the time because it's a natural thing to do until it isn't. I was having high sensitivity to pain in my mouth, and yet normally I had no sensation in my mouth due to radiotherapy. I had tightness in my neck. If my neck was in the wrong position, I got cramps. I had recurring oral thrush, intimacy issues, low self-confidence and very low self-esteem, psychological problems, and high anxiety. My head and neck cancer department said it's not cancer, and we only treat cancer here. So then began a process of being referred to different departments. However, it felt like I was being bounced around the departments because nobody knew what to do with me. I started with a chronic pain department, and the appointments were by phone only. And for a speech impaired person, that's really tricky. And on top of that, the professionals had no expertise in head and neck cancer. The first phone call, my husband was there, and he was able to educate the physio on the other end. But from then on, the phone calls had to be during my work hours, with me on the other end, not being able to be understood, and in tears usually with frustration and pain by the end. They tried various medications with me, but I had to keep increasing the dosage. Of course, one of the side effects of the medication was a dry mouth, which I already had. And this continued to worsen. And this then caused problems with eating, which I had an issue with anyway. My diet was drastically changed due to what I had been through and what I was able to eat. There was then no communication between the hospital and the GP surgery, and my prescription wasn't being refilled. I was called an addict by my GPs, and they refused the medication. And the hospital said it wasn't their job to post a letter about my increased medication, so I was left with nothing. So I ended up having to go to work while having withdrawal symptoms, working with very young children. So I refused to have any more medication. I was then sent to rheumatology, who had no idea why I was there, but they did a thorough examination and then sent me back. Then I was referred to ENT, and so a really unpleasant consultant who made insulting references to my neck scar, and then he sent me back. As I've said, my GPs weren't particularly supportive. Quite a few GPs have actually refused to examine my mouth when I've been in pain. saying they didn't want to get involved and I had to go back to hospital. I've been stereotyped so much, saying I'm a smoker and a drinker because of the type of cancer I've had. I have educated these individuals, and that's exhausting in itself. Now, I've mentioned intimacy as a late effect. This is a huge one, and one that is currently being discussed between our support platforms within the Mouth Cancer Foundation, and I've moved it on to other platforms as well, because it needs to be talked about. Many relationships break down because of these cancers. My intimate relationship with my husband has changed, and I hope I don't offend anyone with what I say, but it really needs to be talked about. And it isn't easy to do, and we as couples don't get support with this. I can no longer kiss my husband. Yes, I have lips, but I have no feeling in my tongue, and I have no control over my tongue. I don't know what it's doing. And the dry mouth definitely doesn't help. We've tried several times, but I just can't cope with much in my mouth anymore. I think the trauma of the mouthpiece with my radiotherapy mask, so I was feeling gagged all the time, every day, makes having anything in my mouth almost impossible. Hissing passionately used to be a big part of our foreplay, and being playful with our tongues. And now I can't do this. I can't reciprocate much in the bedroom anymore. Oral sex is a no-go, as my jaw clicks and grinds and locks, and I've had varying degrees of different pains in my mouth on a daily basis. I went through the menopause during my cancer, so I had issues down below also, and had trauma with smear tests and unkind professionals, which has left a lasting and devastating impression. So my only way to reciprocate in the bedroom is by dressing up. I can't talk dirty either because of my speech, and it just doesn't work the same anymore. If my neck is at the wrong angle, I get cramps and can't swallow. It's really frustrating. And I'm hearing more and more from other patients and partners exactly the same, and they're not being supported either. We need to be having these conversations. We are all left to fumble through these emotional hurdles. So I had to leave my job in education last January because of a lack of understanding and compassion about my late effects. In the last year at work, I suffered really severe depression and became very isolated within that environment. I had introduced a voice app to help when I was having a bad day with pain and speech, but some staff members didn't like me using it. So I brought in a different type of speech app that I didn't have to talk into, but instead typed into. The app to talk for me. But then other staff were getting impatient with this too. I was also bullied by a teacher I worked with over my speech and lack of ability to pronounce sounds or phonics. 50% of head and neck cancer patients are unable to return to their jobs or hold their jobs down after these cancers. I left my career and thought I might be able to find something else, but that didn't work out. And I remained unemployed and felt really low and rejected. I then had to look at claiming disability benefits, which took ages and was really hard to do. But with the support of Macmillan and a fabulous caseworker, this was successful and helped take the pressure off of looking unsuccessfully for jobs. Now, before I left my job, I became a patient ambassador for the Mouth Cancer Foundation in the past 4 years, and I co-host a 2-hour weekly support Zoom every Monday night with Josh Harding, who is a dental hygienist and president-elect of the charity, and we run this every week throughout the year. I also run a private support group on Facebook, the Mouth Cancer Foundation, for the charity, for patients and family members, and I can see so many out there suffering with late effects like me. I was also aware of a few late effect services like Lara's that were available to some patients, and I wanted the same everywhere because it really feels like it's a postcode lottery. Now, there are over 60 late effects with head and neck cancers, and sometimes very little quality of life. We all deserve quality of life after our cancers. So I struck up a conversation with the head of radiotherapy visits at Southend Hospital, Nikki Wild, regarding the late effects of radiotherapy. And at the time, she had no idea this was a thing. However, the conversation has now begun, and another patient, Sammy, is also involved with it. Nikki was introducing me to professionals within the East of England and Radiotherapy UK. I started focusing my time on presenting to whoever invited me to present and talking about the importance of support and how we deserve proper aftercare as in the late effect clinics. My belief is that the treatment plan should be diagnosis, surgery, treatment, and late effects. Over the past year, I've been introduced to amazing, dedicated professionals like Lara, who is also a member of our private Facebook group and supporting our patients and family members through their difficult times. I'm also in regular conversations with late effects leads from other services, Emma Hallam, Sabina Khan, and Samantha Bostock, who do incredible work. I've been presenting both online and in person, and I will continue to do so. I'm speech impaired, so I now take my speech apps with me to help with introducing myself if Ian isn't with me, as I can no longer say my name properly. I've also been introducing Makaton because I use Makaton at home. I just wanted to show you, I can't talk on the phone very well, I can't say my name. So there are sometimes we have to use the phone for appointments, and I now explain to them that I have an app that will say my name for me. If you bear with me.
My name is Karen Liesting Schroeder.
And that helps on that score. I also have, for spelling my surname, it's too long for me to spell.
Liestingschroeder.
So that's just a little demo to show how I communicate at times. 4 years of late effects and I'm still being bounced around departments. But I can't see a light at the end of that tunnel. I am turning it around into a positive with all the work and campaigning, and hopefully for more silver linings for our head and neck cancer patients. Why should our patients have to suffer so much? They shouldn't. You can't treat cancers anymore without having the proper and appropriate care afterwards. I've written powerful letters, emails, attended meetings, presented on behalf of all the patients and family members to professionals within various departments, both healthcare and dental, and to students. And as Lara mentioned, we now are delighted to say that the East of England have approved and agreed to fund a late effect service at Southend Hospital for head and neck cancer patients. There is a lot of work involved with setting this up, and the clinic will be run by a therapeutic radiographer, because we need specialists who understand the intricacies of our cancers to help support our patients. A diagnosis in head and neck cancer, which usually does lead to late effects, but not everyone will get them. It affects our eating, drinking, swallowing, breathing, talking, and intimacy, and they're not being properly addressed at the moment once the cancer has been treated. Many of our patients are left with visual scars, disfigured, with altered speech, and not supported afterwards with these either. Mental health is a huge issue. So I was going to say thank you for letting me share my experience with late effects. I know it is a huge issue to be addressed, and we're desperate in need more clinics within the country. We need recognition for these amazing clinics and the professionals working hard within them to keep our patients' quality of life. If you wish to connect with me at any point, I'm happy to do so. Thank you.
Thank you so much, Karen. That was a tour de force, and it just goes to show how much more work needs to be done in relation to the treatment of late effects of different sorts of cancers from different sorts of treatments. Well, I will now hand over to Jane Barker-Colson, who has been monitoring the impact of the questions that you've been putting in, and she'll start doing them now. Because we've slightly overrun, we'll carry on this session until 7:40. so we get all your questions in. Thank you. Jane, over to you.
Thanks, Ray. I just want to start by saying thank you to Lara and to Karen. Lara, great presentation, lots of really great information in there. And what we will do when we upload the recording, we'll put Lara's presentation alongside it as well. And thank you, Karen, for sharing your experiences. It's very brave of you to come on a call like this with so many people that you don't know and share your story so honestly. So thank you for that. I'm just going to stop recording and then we'll move on to the questions.